our System of Support series this year. We have two areas that we really wanted to look at with the counties based on feedback from the field and based on some of the things that we see through pre-K program reviews over the last 3 years. As you all know, we are in our 3rd year of pre-K program reviews since we became universal in the state. So we really wanted to look at 2 key items today with you. So we're going to spend part of the day or part of the webinar this morning looking at pre-K health and safety policies, procedures, and tools. And there are some changes, but there are some things that haven't changed over the years that we really just kind of want to look at with all of you. And as we go through this, there have been some new federal regulations that have come about, and we want to give you all the most information to really develop or refine your system to really hone in on health and safety. The second piece of our webinar, and our kind of a 2-part webinar, is we're just revisiting the Early Childhood Classroom Assistant Teacher Authorization. It's new this year, so we wanted to do some follow-up through this webinar to really look at some of the questions that you all have and some of the things that we're seeing, and some information from the Office of Professional Preparation, as they've really taken on a lot of things. Give me just a second. I think that the screen is not being shared. Aha. All right. I think we have it now.
Okay, thanks.
All right. There we go. Okay, I think we're good to go now. I apologize for the delay. So let's talk about the first piece of health and safety, and I think that this screen really sums it up. In Policy 2525, basically the introduction to health and safety is recognizing that all children in our pre-K system shall be safe and have healthy environments. We have to make sure that those provisions are in place and that all rules and regulations of the collaborative partners need to be maintained. And Tracy will talk a little bit about some of the things that are happening with Head Start as far as new requirements for ensuring health and safety. So basically we want to just start out with their policies in place to support health and safety in the pre-K system. Collaborating child cares also have the child care licensing regulations that they have to work with. And they've been aligned with Policy 2525 to ensure that in child care centers, the same language is consistent across the board. So individual classrooms and individual programs have to have processes in place to make sure that they have those health and safety provisions in place. A couple of things that we historically have done are health and safety checks. We'll talk about a revised version that we have drafted. We also have the ECRS-R that historically has been used to also measure practices for health and safety. We're going to talk about that and some of the changes that's happening around ECRS. And now we have a new health and safety screener that is completed with every collaborative Head Start site as well. So that's just going to guide the whole process for this morning. All right, so health and safety policy, in policy 2525, what we've done is, I have a link here for our Google site, and most of you utilize the Google site quite frequently, but I just wanted to put it up on the screen so that you can see. If you go to this Google site, you can go chapter by chapter through the policy, and for this piece, you can go straight to section 12, which is health and safety. However, this is not the only section where health and safety is addressed, and so what I kind of wanted to share with you all is, based on the policy revisions that were done that were in place as of July 1st with policy 2525, the health and safety checklist has been revised. It's in draft form right now, but as with some of the other changes that we're going to talk about, over the last decade, we've had a continuous quality improvement subcommittee to address processes that are in place for pre-K, and that committee has kind of governed what will happen with the ECRs and what is actually articulated in policy 2525. So what we want to do is, with the changes, is reconvene that subcommittee to make sure that we're covering all the bases with representation from all the collaborative partners, and make sure that we're encompassing everything in the continuous quality improvement process based on changes in policy, based on changes from the federal government, and again with the ECRs. So I just kind of want to share with you the draft health and safety checklist, and this went out over the listserv this morning, but it's broken down just sort of like policy is broken down. So you have your section 12, which is specific to health and safety, and it's chunked sort of in content areas. The first piece is it looks at class size and ratio, and then the second section, in section 12.2, it looks at the class size and ratio. Section 3 is basically supervision in addition to section 2, so those kind of go together. And then section 4 looks at brushing teeth and oral health. Section 5, it talks about rest time and sleeping equipment during rest time. The content really didn't change much, but it was sort of reorganized to flow better. And then sections 6 and 7 and 8 are specific to universal precautions and communicable diseases and the requirements under the policy for that. Section 9 is hand washing. 10 addresses pets in the classroom. So this stuff is, again, not new. Section 11 and 12 are actually materials in the classroom that could pose a health issue or a safety issue. And then you can see that we've also included the pieces from environmental design. The policy revision back in 2012 kind of took some of the health and safety pieces and chunked them out into other areas as well. So the environmental design that looks at the classroom structure, the building structure, used to be in health and safety, but now is in environmental design. So you look at the first part of it in section 13, looks at the actual facilities, indoors and outdoors. So you have, addressing toilets, square footage outside, outdoor time, and then what the outdoor space looks like with the barriers or fencing. And it just kind of takes you all the way through that. I don't want to spend a lot of time on this. This is in draft form, and this is something that we're going to present to that subcommittee when it's reconvened to get a critique and input from the field. We want to make sure that those folks who are utilizing it, that it's practical for. But the main point is that some system has to be in place in order for you to be confident that all health and safety provisions are being addressed in the classrooms. And then the last section on this form is transportation. Now, this was never a part of it before, but had a part of the health and safety checklist before, but is really key. There have been over the years, there have been several health and safety issues for transportation. So we added this piece to address that and to really get counties to hone in on health and safety around transporting in and out. And that's probably one of the riskiest parts of the day, is during that transportation to and from. So that's just the draft health and safety checklist with the changes that we've had, and we will be utilizing with, like I said, that subcommittee that we're going to reconvene. All right, I want to take just a few minutes to talk about the ECRS 3. For those of you who haven't heard, the ECRS R has been revised and is now called the ECRS 3. It's a really interesting revision, and the actual ECRS 3 was just released in mid-November. We have one copy of the new scale. Our team plans to go out and utilize the new scale just to get a hands-on glimpse at it. But I did want to share with you all a presentation actually from the ESI Institute, the folks out of the Frank Porter Graham Institute, who helped to revise this, and it's the same authors. But I wanted to just kind of show you some of the changes really quickly. We're not going to go into it extensively, but there's been a lot of key questions about what the changes look like. And out of the Frank Porter Graham system, they have provided this slideshow of the changes. And so I just want to hone in on a couple of screens. But this was also one of those attachments on the email that went out over the listserv this morning with as an attached document. So every core team member should have received a copy of this presentation through the webinar or through the listserv webinar email. So the ECRS 3, basically, they're refocusing on teaching and interactions a little more than what they did before. Here's some key differences between the two. The ECRS 3 utilizes better scaling on the number of key indicators. It'll take 3 hours now, and relies on solely what's observed rather than what's observed and a teacher interview. So it looks like the teacher interview is going to be not a part of that anymore. They've refined the age groups to 3 to 5. Before it was 2.5 to 5. And the biggest one is ECRS 3 does away with the substantial portion of the day. Some other key changes: adult-related items are dropped. Major hazards, which were noted before as indoor/outdoor, are now separated. They look at those in 2 different indicators. Increased emphasis on pre-academic skills, and more emphasis on interactions with materials based on children's ability. So those folks who've reviewed the changes so far have really been impressed with some of the changes, and we'll look at how we as a state will transition into this process. because it will actually, the ECRS 3 will actually replace the ECRS R eventually. And I think that the materials for ECRS R will not be available after the transition period. Whoops, kind of has a mind of its own. You can, when you get this file, you can actually sit and watch it, and it just kind of runs through it for you. But you can see the subscale differences. No longer have parents or staff. Language and reasoning is now language and literacy. Learning activities, interaction, program structure, those are similar. You can see that the key differences in space and furnishings. I'm not going to take you through each and every one of these. I just wanted to show you that that's what's available on this PowerPoint. And it takes you through each of the item level differences that you can, you know, on your own you can go through. There's 3 new math items. I'm going to leave those up. Math and daily events, understanding written numbers, and math materials and activities. Well, kind of takes off, doesn't it? So there are some pretty significant changes, but it focuses much more on the experiences that children will have and the use of materials. One key thing I think that I found very encouraging is that the emphasis is matching teacher interactions with children's abilities to interest and engage them. And you might be thinking, why is this completely applicable to health and safety? But it really is applicable because the ECRS has been used to over the last decade, at first annually and now once every 3 years, as a process to analyze health and safety in the classrooms. The ECRS 3 or the ECRS R is only required once every 3 years. So on those off years, what are you all doing as a county to ensure that health and safety processes are being, are being met? Oops, I just wanted to take a minute to show you all that this is the feedback that they got from the field test and some of the statements that were made. I like the one down in the corner. It says it's great to see the shift from emphasis on materials to practice. So it's not just about what's in the room, but how it's being utilized. If you have to put all this stuff in the classroom and you have to make sure it's healthy and safe, how is it really being implemented into practice? So here's just some key information about the rollout of the ECRS 3. What we do know is that there is a transition period in place with the ERSI group that facilitates the rollout, and that there will be transition periods for the raters. The one good thing about the tool is that once you're a reliable rater with the ECRS R, the transition won't be very difficult for those folks who are reliable raters. Okay, there we go. All right. So we're going to let Tracy talk a little bit about the Head Start requirements that have evolved over the last year and with the health and safety screener.
Good morning. Well, as you know, one of the beautiful things about our universal pre-K system is that it's collaborative. It also means one of the challenging things is that it's collaborative, because each of you that are on collaborative teams have to understand your own system and have to understand the other systems that you're collaborating with. And this is a particular area where, as Janet alluded to, with Head Start, that over the last several years there have been changes. To give you a little relevant information, Head Start grantees and their grants used to be considered indefinite grants. That meant as long as they were found to be in compliance, they would continue to be able to provide Head Start services within their community. Now, as of the last Head Start reauthorization of the federal law, it required that Head Start convert all of those indefinite grants, with every Head Start grant in the country, into 5-year grant awards. And so through the process of those conversions, Head Start has built in some additional requirements for the programs when they receive their new 5-year awards. It also means that not every program in the country transitioned to a new 5-year award at the same time. It was merely impossible for them to process all those grants. And so what we have as of today in West Virginia is we have a majority of our programs have been converted to 5-year grant awards. However, there are still some that have not. And so because of that, it means that some of you, the information you're about to hear, are thinking, why is she just saying this now? We did this a year ago or 2 years ago. And it's probably because your Head Start program converted then. But there are others on the phone that their partner has not converted yet. And so we want to get out accurate information and make sure that there's a resource online that people can refer back to. So let's look at one of those new requirements. One of those new requirements when programs convert to a 5-year grant award is the completion of a health and safety screener. And that is it says here in every center, but of course that means for every classroom located within a center if it's a multiple classroom site. And it's very specific, and you see the language here, and I pulled it out specifically and put it here because I think that's important, that, again, they have 45 calendar days in order to complete that. At the end of the completion of those, they actually provide a verification, a certified verification to the federal office that those have been completed. And so it's very important, and hopefully now you can see how, as a collaborative team, teams really need to understand the various requirements and come together and make decisions about how these things are going to be completed and how these requirements work together and not in opposition of one another. And so I think that's a very important point to think about. And again, Janet also mentioned that at the conclusion of our conversation here, we're going to talk about some next steps for us to utilize the expertise and knowledge from those of you in the field to help us look at state systems or expectations. Okay. Sorry, I'm not good at that. So what I've also provided for you here, again, because you may want to refer back to this, is a link to the actual health and safety screener. And again, I always encourage all of you to become familiar with the Early Childhood Learning and Knowledge Center. However, it is a large website, and so I know it can be very overwhelming. And so I just want to show to you, if you click on the link here, so when you come back, it is going to take you to the health and safety screener. It'll take you again to the language of what I just explained, and there is a link here in PDF to take you to the screener. I'm going to pull that up as well because I want to walk you through the process. And I also want to point out that what you'll find when you look at this document is that the categories that are a part of the screener, they are not representative of all health and safety requirements, but they do span across the categories of environment, policies, and procedures. We're just waiting on this to pull up. Janet is looking now. Sorry, it will work, but we think that, whoops, we're going to pull it up this way. I'm going to cheat. Oh, oops, okay, just, yeah, go back. Sorry, trying this again. I'm technology challenged. This is the health and safety screener. And so you'll see that there's a brief introduction. There's a form that the programs need to use and fill out. As I mentioned, the first area is environment. And you're going to see overlap with some of the themes between this and our existing health and safety checklist that is in place for pre-K. We're also going to go down and see health and safety procedures. Again, you're probably going to see some overlap. You may also see some differences between what's contained between this document and the existing universal pre-K checklist. Supervision, and lastly, transportation. So again, I just wanted to walk you through, make you familiar with it, and help you understand, so also building administrators and others can understand that depending on how your team has made decisions of how this will be completed, that there may be individuals that are different than typical individuals needing access to the classrooms to complete these observations. And most importantly, the intent of this is to make everyone aware of the status of the health and safety, and then to have communication about what you've learned and then what will happen as a result of it, which is, again, it should be a part of your ongoing continuous quality improvement activities anyway. So we hope that this is something that's going to be useful and meaningful for all your programs. And if Janet can assist me to get back to the PowerPoint. Whoops. Whoops. Uh-oh. Why don't you do that? Okay. All right. CSL Dome Technology Challenge. I'm a Mac user, so moving right along. One of the other changes that has happened is that Head Start has a new aligned monitoring process. And we mentioned this briefly at this year's Leadership Institute. I just, again, want to take this opportunity because there are new folks all the time. And so we're trying to spread awareness. Head Start programs used to be reviewed every 3 years. That process is now finished. And now programs have review events over the course of their 5-year grant award, particularly in those first 3 years of the 5-year cycle. One of them, so before review teams would come and they would look at all components of the program. They have now, as a part of this aligned monitoring, been able to break that down and be able to primarily look at 1 to 2 areas at a time during each of the review events. And so all Head Start programs review events are individualized and tailored. And so they vary from program to program in regards to what review events they may receive within a year. However, all these review events are applicable to every grantee. And so it's important we just briefly take a minute. I wanted to make you aware that there is a Head Start review event around environmental health and safety. And that means that there's a protocol that's been developed to specifically guide what they'll be looking for during their review event. And this is another resource that can be used for you. And I want to, again, take you to eClick. I'm going to click here and show you. I encourage all of you to become familiar with this and to, if you haven't already, talked with your Head Start program about this or take an opportunity to explore the site. I encourage you to do this. This is the part of eClick that relates directly to the aligned monitoring. And this expo is a wonderful thing. One of these will give me this really cool tool. I just want to check. It's not that one. Let me, okay, Janet, sorry. Yeah, sorry. I want to go back. I made a mistake. Probably here. Sorry. See, I should have rehearsed that part first. Well, it's not taking me to it. I apologize. Wouldn't you know? One of the... Where? I'll just take us back to the PowerPoint. Gotta go down here. Okay. All right. I apologize, but there is a link to the protocol there, but it's also included in the email that went across the listserv today. And we'll double check that link and make sure that it's accurate. But all information regarding all review events are there at the expo. You will see there was a login and password. Each program probably has one. You could also apply and get your own. But just briefly, I want to mention that every center, this is another significant change with the aligned monitoring. When they used to come for the review, they would do a sample of all the classrooms. Now that they're looking at a particular area at a time, this allows them to visit every classroom at every center that Head Start is a part of. And so that is a big change. And again, we just wanted to make you aware. And we've had several programs already this year that have received this environmental health and safety review as well. And here, we were smart enough to also give you the link directly to the protocol. Aha, this is what I was looking for. This is what I was looking for. And you can click there, and it'll take you to the protocol. Last but not least, to wrap this up, that in summary, we thought this was a pretty powerful quote, that strong systems support high-quality services, and high-quality services lead to positive outcomes. And so all the systems, but in particular what we've talked about already this morning, health and safety, this is one of the reasons why it's so important. So we've talked about, we want you to reflect about what your team and what system you currently have in place to implement that these health and safety standards are met. How are they included in your continuous quality improvement process? We hope that teams really contemplate that and really have conversations around that and have an awareness of the various regulations and, again, are working together to develop a unified system. Jenny, you want to talk about next steps?
Yeah. So next steps, we have two parts to our next steps. One is for your team, like Tracy said, to analyze what do we have in place to ensure that all of our classrooms are healthy and safe. So if we have something in place, do we need to review it to ensure that we've covered everything? So that's what we really want you to take away from today as far as health and safety is look at your system, see if it needs to be refined, or do you have what you consider a system? If not, then you want to look as a team on how to develop that. The other piece of this is we want your thoughts and feedback on the development of state tools to help you all with your system. So if you would like to be a part as we reconvene that continuous quality improvement subcommittee, email myself or one of the other steering team members and just let us know that you would like to be a part of that. And we're going to get the ball rolling with that really in our groups beginning in January, February. So let us know if you want to be a part of that, and we will absolutely include you. And I think we have a question. So for the Head Start Collaborative Classrooms, do we do 2 health and safety checklists?
At this time, in regards to if you'll need to do 2 health and safety checklists, the answer is yes, you probably would, because each Head Start program has, when they send in the certification, they're certifying to the federal government that they have completed a screener that is inclusive of all those items that were on the health and safety screener for Head Start. So that means any items that is not currently included in the pre-K health and safety checklist would most certainly have to be collected and analyzed as a part of that process. So it's one of the reasons why we are wanting to explore this topic and to not create duplication. And our goal really is to be able to create a tool that meets the needs of both systems.
Yeah, and if there are programs out there that have already worked to blend those, we would love, and we'll give you the credit for creating that document. But we know that one program actually was actively looking to marry the two documents to minimize the duplication. So that's what we're really going to be focusing on. So the answer is yes, but if you've married those documents and you know that you're covering all the bases, you technically, as long as you're meeting all the standards and you know that you are, then your process is probably better than what's in place now. Any questions about the health and safety? When we post this recorded webinar, we're also going to post this PowerPoint presentation, and we're going to post it in the PowerPoint format so that you can take it and you can pull off all of the links and utilize the information how you see fit. What we've put on here, we want you to be able to use. So we'll post it just as it is. There's another question. Could there be a question about a person that is assigned to check playgrounds before the children go out?
Can they add that question? Is that what they're asking?
Oh, are they asking to add it? Okay.
You want to?
Well, I think that's about pre-K. Well, I think, this is Tracy, in regards to the health and safety screener for Head Start, that form is a federally developed form, and so there couldn't be any direct changes to that form. However, I think this process that Janet talked about, when we convene individuals from the field to look at trying to create a tool that is inclusive of everyone's needs, I think that maybe that could be considered as a question that may need to be included in the future. I don't know if that answered your question. Who submitted it? If not, you can let us know. But yeah, so Brenda, if that answered your question, you can let us know. But if you want us to add it to the list of things for that team to consider, I think we can.
Absolutely. If you have any other questions, you can also use the raise your hand function. I don't think that's what it's called, but if you want to raise your hand, we can also unmute you if you want to ask a question. All right, so we're going to go into the second part of this. If you have questions later about health and safety, just email one of the steering team members, and we will make sure we get an answer to you. And again, let me remind you, if you want to be a part of that continuous quality improvement subcommittee to update this process, to include the Exercise 3, to merge some health and safety checklists, please just let us know. We're always happy to have eager people to join us to make the system better.
And you already got two from the crowd, actually. There you go.
Yeah, so the next part that we're going to go into is the Universal Pre-K Personnel section. I have to let the screen catch up. All right, so I asked Rhonda to just kind of give us some of the things that she's been tackling with folks out in the field. And Jody's with us too. She sat so patiently through health and safety to just kind of hit some key questions that are being posed a lot. So I'm going to let Rhonda go ahead and Jody go ahead and tackle some of these questions.
What I did, some of the frequently asked questions that I've been getting, at least in the last month or so, it's still a question on who is really eligible for the ECAT. And the special needs issue has been one because if it's just a special ed aide, if they're assigned to a one-on-one child and their job is posted as special ed aide, they are not eligible for the ECAT. But if they are a preschool special needs in a preschool special needs classroom and they are assigned as that classroom aide, they are required to get the ECAT because preschool special needs classrooms are considered an early childhood classroom, and it's in policy 2525 as a West Virginia Universal Pre-K. So that's one thing we just want to clarify. And sometimes it's really been more of a question with kindergarten because there's more kindergarten special needs aides that are assigned to resource rooms or autism mentors or just those one-on-one aides that go in and work with one child. But if it is a classroom aide, they are required to get the ECAT. As we've been doing reviews, and I've been looking at a lot of the certificates and we have as a team, there are a lot of them still pending, a lot of the Form 41s and Form 50s. It is the responsibility of the person who's getting the certificate to track that. I know they send emails, and Jody might even want to talk about this. They send emails, but we had, yesterday I was checking on a couple teachers from one county, and they had been denied a Form 50 in 2012. And they never checked up on it. They were waiting on transcripts. The Office of Professional Preparation has a timeline too. If people do not get the information into them, they're not going to keep sending emails. It's up to the individual person to track that. And we put the link on there how you can track that. If it says pending, there's usually a reason why it's pending if you look on the form. And it's usually, it might say being under review. If it's under review, that means that the Office of Professional Preparation are still looking at that. But if it says they need fingerprints or diplomas, transcripts,
State competency, exam proof.
Right.
Those are the ones that are holding us up the most.
Right. So, and we know our collaboratives do not have to have that state competency exam, but our county employees do. So
this is the screen that you will come to first when you're checking the status, and basically you're, you're agreeing that you are the person, and then when you click agree, it takes you to the screen to get the access, and you have to have your last name, date of birth, and the last 4 digits of your Social Security number.
And then when you hit show certification, it will tell you if it's pending or if they can print their certificate off. They do not send the certificates anymore, but the person can go online and get that. So it's just important that they know they have to follow up. Also, when especially, we can go to the next one. As you're thinking about renewal, renewal begins January 1st. So after January 1st, anybody that's on a temporary permit, whether it's a lead teacher in a collaborative setting or the assistant teachers, they need to start the renewal process after January 1st. When you begin to sign contracts with collaborative partners, the lead teachers and the assistant teachers in those should already have their renewed certificates when you're signing those contracts. So, and that should be before July 1st.
And each LEA needs to have a copy of collaborative ECAT authorizations and teacher authorizations or certification.
Yeah, in some instances, the collaborative partners need that also from the LEAs. So that should be something in your core team meetings that you make sure that there's a process to where that information is shared. Our e-learning registration is open. These are the lead teacher courses that are offered this time. And I've also put the link on there. Most of you know that. But these are for lead teachers. These are the 3 courses we'll be offering this session. There'll be another session in the spring for lead teachers. The teacher's assistants, we offer all 3 courses every time. The registration opened November 1st. It is still open. It will be open until January 2nd. And the courses begin for lead teachers and assistant teachers on January 7th. Lead teacher courses go 7 weeks. Teacher's assistant courses go 15 weeks. If you have questions, please email me. I'm on the road a lot, so emails probably the best. Also, Robert Hagerman, if you have office questions in the Office of Professional Preparation. Now I can give you Jody's.
Absolutely.
You want to give them your email?
J. Oh, okay.
I'm going to type it.
She will type it in for you.
JOLIBETO
And again, her name's Jody Olivito-Moore. She's like Janet, our little hyphen person. But anyway, and then Scotty Ford is the contact for the lead teachers, and she's also from the Office of Professional Preparation. Donna Landon works a lot with the coursework for e-learning if you need to contact her. So if you have any questions, please feel free to contact me. Yes, and one thing, Tracy just wanted me to make sure you know, for CDA or apprenticeship, the ACDS, you can give a copy. I know last year when we did our informational meetings, we said we needed an original, but now we have worked it out. You can send a copy of their ACDS certificate from the West Virginia Department of Labor or the CDA. It can be a copy. It doesn't have to be an original. What's that question? Could there be?
That was already there.
Oh. Yes, when and Tracy's given me questions, and probably you have them, and you can ask too. For collaborative partners, I know there's been a big question: who signs off on their Form 41s or Form 50s? It has to be the one who employs them, so it has to be the child care director. Now, if you want those applications to come to the Board of Ed and you mail them in, that's something your county can work out. But it does not, it should not have the superintendent's signature. It should have the director of that collaborative program.
Question. So if they have a collaborative contract and they pay for that teacher in that child care center, does the superintendent then sign that?
If it's who the employee is, if the even if it's a collaborative program and the teacher is, but they wouldn't be filling out a Form 50 if they're hired by the county. So if they're filling out a Form 50 or a Form 41 and they're in that collaborative program, the person that signs that is the one that employs them.
Okay, so we have a question. It says it's almost personnel season. Please clarify with certification policy the grandfather clause for aides that will retire by 2020. Are you stating that this option is not available to preschool aides and only to kindergarten aides?
That's a yes or no question. I know we love those. Kindergarten aides, it definitely applies to them. If they are eligible to retire, it doesn't mean they have to retire. If they're eligible to retire by 2020, they do not have to get the authorization. But again, they're not grandfathered in. So grandfather clause doesn't work here. They are not grandfathered in and have the authorization. They remain as an aide. They are not reclassified as an assistant teacher. So for pre-K, if you are collaborative with Head Start, the retirement clause is not effective. It does not encompass Head Start. So if you're in a pre-K classroom that is not collaborative with Head Start, it could work. But if that classroom would ever become collaborative or you would get one Head Start child in there, that becomes a Head Start classroom.
And that would have to be completed through the contract.
Right. That's definitely a contract.
We have another question. I just want to make sure that we didn't miss any questions as well. Bear with us. The next question is, what are the required documents that is needed to be supplied for permanent authorization upon completion of the ACDS?
They have to have their certificate from the West Virginia Department of Labor. That's all that needs. And for to prove their ACDS, they still would have to, make sure they have all the other that any. Go ahead, Jay.
A competency, a diploma and or high school or equivalency, and then the certificate.
Right.
Oh, yeah, only if they're county employees.
State competency if they're county employees. But for the ACDS, it's their completed certificate and the one that has the seal from the West Virginia Department of Labor. We don't need each of the 4 sessions, and this is for permanent. If they're doing renewal for a temporary, they have to send the certificates in for evidence that they've completed a semester, at least 1 semester.
And it just needs to be copies of the U.S. Department of Labor certificate, just to make that clear. And that is a change.
From what our information we sent out before, yes. Other questions?
Another question, what contract are you referring to? The Head Start contract, because aides have continuing contracts with the BOE. What we're referring to are the collaborative contracts. So when 2 programs enter into contractual agreement, what we're saying is that any temporary or permanent authorizations need to be attached with those contracts, or because what happens if they're not followed up upon during contract time, then what happens is sometimes they forget to get copies of those, and then lots of times partners don't have the documentation to prove that their staff are qualified to be in that position. So what we're encouraging everyone to do, not just one entity, but everyone to do, is obtain copies of those certificates or authorizations to ensure that they have those in place. Right now, there are a lot that are pending, and we know that for this year. Next year, we shouldn't have that, and that's why, as we're collecting data this year through the new application through WEVIS on the web, we've removed the requirement that you have to indicate that, because people are still pending in a lot of cases. But we're going to go back after the close, after the fact, and add that information on. So core teams really need to be still working on making sure that they have those on file for everyone.
We're still finding when we're doing reviews that some aides haven't even applied for their ECAT, which that makes you out of compliance, because as of July 14th, 2014, the policy and the law the code says that they need to have a temporary or a permanent authorization. So they should have at least applied, and it should be pending. Because once it's received in the Office of Professional Preparation, it's pending. They do a mail, they open their mail every day. So.
All right, then another question. When hiring a pre-K or K teaching assistant, how are the seniority dates determined?
We have recommended, we've sent out many, many emails, and even Amy Willard in the finance office has sent out emails. We are recommending that you multi-classify these positions, because, again, this is a new classification, and at this point, anybody before October 14th, I think, their date on their certificate is going to be July 14th. So you have to do a drawing and figure out seniorities for that classification, however you do that in your counties. For hiring these positions, we've recommended that you multi-classify, and the grievance board has said as long as you use the same system across hiring all, that if you use that aide seniority date, regardless, even if they're willing to pursue, if they don't have the ECAT yet, they're willing to pursue, you can still use that aide seniority date to hire by. Does that make sense? Who asked me that? Michelle Martin. If you have questions on that, you can email me, Michelle. But like I said, we really have, for more reasons than I can go into today, you really need to multi-classify those positions and then hire on that aide seniority date. And your posting can say something like already have or be willing to pursue the ECAT. You ask how the seniority dates are determined. Some counties are doing, I don't know, they draw straws or however you do that. You have to get that would be a personnel question. I'm not sure. Different counties do things different ways. Temporary is one classification, permanent's another. So those are two different classifications with different seniority dates.
That's a very good point. Any other questions so far? If you have further questions, Rhonda is wonderful at getting back to folks and getting those answers out.
You can also email Jody now.
Team.
Yeah, we're a team. She's been working a couple weeks now, and she's on the fast track.
All right, so we're going to end just by letting you all know that this PowerPoint will also be included on the webinar as recording page. In the email that I sent out, in each of the emails that I sent out, there was a link straight to the System of Support webinar page that you can access these two as soon as we get the recording finalized, and it should be up by Monday. And I'll send a follow-up email and include a copy of the health and safety screener that was not included in the previous email too, and the link to the recording too, so that for those who weren't able to join us today, or if there's a piece that you want to look at again. As always, please feel free to contact anyone from the steering team, Jody or Rhonda, with any questions. And we will have our next webinar on the second Tuesday. I just changed it. I'm sorry. On the second Friday of January, and we will be addressing the dental requirements. So Merry Christmas, Happy New Year, and we will talk with you soon.